Welcome to Review Central. This is NCLEX Reviewer number 9, featuring questions on reduction of risk potential. This reviewer is intended for those who are eyeing, or are set to take either the NCLEX-PN or the NCLEX-RN. There are 10 questions featured on this reviewer. All questions are modeled on actual questions that appeared on previous NCLEX exams. Let's begin. Question number 1. A patient is being evaluated for pressure ulcers using the Braden scale for predicting pressure sore risk. The patient is continent of bladder and bowel and eats well. The patient has flexion contractures of the knees and elbows. She requires maximum repositioning and slides down in bed. What is this patient's greatest risk for pressure ulcers? A. Moisture. B. Low protein. C. High mobility. D. Shear and friction. The correct answer is D. Shear and friction. Pressure ulcers, pressure sores, bed sores, and decubitus ulcers are localized damage to the skin or underlying tissue that typically occur over bony prominence as a result of pressure, shear, or friction. The most common sites include the skin overlying the sacrum, coccyx, heels, or hips. This patient has an increased risk of pressure ulcers because of shear, friction, and contractures. The Braden scale for predicting pressure sore risk categories include friction and shear, nutrition, mobility, activity, moisture, and sensory perception. Question number 2. Which of the following is true of urinary tract infections? A. There is no relationship between UTIs and anatomy. B. 20% of children develop urinary tract infections annually. C. Bladder relief need not occur more frequently than every 8 hours. D. Young children are at greater risk of kidney damage than any other age group. The correct answer is D. Young children have a greater risk of kidney damage linked to urinary tract infections than older children or adults, including kidney scars, poor kidney growth, poor kidney function, high blood pressure, and other problems. About 3% of children develop urinary tract infections annually. Ideally, the bladder should be emptied every 2 to 4 hours in children. There are anatomical reasons some children may be prone to urinary tract infections. Question number 3. What is not a risk factor for PROM? A. Infections. B. Trauma resulting in abruption. C. Fetuses in the breech position. D. Preceding uterine contractions. The correct answer is C. Fetuses in the breech position is not a risk factor for PROM. PROM, or premature rupture of membranes, is a rupture of the amniotic sac before labor begins. There are multiple risk factors for PROM, including preceding uterine contractions, infection, multiple fetuses, and trauma resulting in abruption. Because PROM is usually associated with other complications, delivery is usually imminent either through cesarean section or vaginal delivery. Question number 4. A monopolar TURP is done on a patient with prostate cancer. After surgery, the patient develops worsening and significant hematuria. Which of the following is not an appropriate treatment option for control of the hematuria? A. Epsilon aminocaproic acid. B. Degarelix. C. Leuprolide. D. Radiation therapy. The correct answer is C. Leuprolide. Epsilon aminocaproic acid is an important clinical inhibitor of plasmin and urokinase. It effectively acts to promote coagulation and is particularly effective in fibrinolysis, which may follow TURP in patients with prostate cancer due to the release of fibrinolytic chemicals from prostate tissue. Radiation therapy in limited doses can be used to help manage acute prostatic bleeding. Degarelix is an LHRH antagonist and will quickly lower testosterone levels, which will help with bleeding. Leuprolide can also lower testosterone levels, but initially, it increases testosterone, making it inappropriate to use acutely in the clinical setting described. Question number 5. What does one call cycles of rapid deep breathing followed by shallow breathing and apnea? A. Cheyne-Stokes respiration. B. Kussmaul breathing. C. Pulsus paradoxus. D. Bainbridge reflex. The correct answer is A. Cheyne-Stokes respiration. Cheyne-Stokes breathing is rapid deep breathing followed by a gradual decrease and then apnea. Cheyne-Stokes breathing oscillates from apnea to hyperpnea. Cheyne-Stokes breathing is associated with changes in blood oxygen and carbon dioxide levels. Question number 6. What disease process is associated with the Brudzinski sign? A. Arthritis. B. Hepatophilus. C. Meningitis. D. Pancreatitis. The correct answer is C. Brudzinski sign is often present in patients with meningitis. The Brudzinski sign is positive if the patient's hips and knees flex automatically when an examiner flexes the patient's neck while the patient is supine. If meningitis is suspected, implement droplet precautions and place in a private room. Do not cohort these patients. Question number 7. What instructions should be given to a patient during a central line removal to prevent air embolism? A. Sit up nice and tall. B. Take a deep breath and bear down. C. Breathe as fast as you can. D. Reach your arms out to touch your toes. The correct answer is B. Take a deep breath and bear down. Air embolism is the entry of a bolus of air into the vascular system. It is life-threatening when it creates a block of blood through the pulmonic valve. Taking a deep breath, holding it, and bearing down is a Valsalva maneuver that prevents air from entering the vein. The instructions to sit up tall, touch your toes, and breathe fast are not required as they do not prevent air embolism. Air embolism treatment is to place the patient on the left side with the head lowered in Trendelenburg position, correct anything allowing air into the circulation, administer oxygen, assess vital signs, monitor, and notify the provider. Question number 8. Which patient with schizophrenia would have better prognosis? A. Gradual onset later in life. B. Acute onset later in life. C. Gradual onset early in life. D. Acute onset early in life. The correct answer is B. The patient with acute, late onset schizophrenia has a better prognosis. Full recovery is rare. A family history of schizophrenia and prominent cognitive symptoms have a poor prognosis. People from low-income countries may have a better prognosis in terms of functionality. Those with structural brain abnormalities have a poor prognosis. Question number 9. Select the intervention that would be least helpful for a confused elderly patient that wanders. A. Placing bells on the shoes. B. Organized exercise. C. Identification bracelets. D. A closed, safe environment. The correct answer is A. The best intervention for confused wandering patients is to provide an enclosed indoor or outdoor environment. Exercise may reduce the need to wander. Bells may allow one to find the patient but would be the least helpful among the answer choices. Question number 10. Patients with sickle cell disease are at increased risk for what type of infections? A. External otitis. B. Acute appendicitis. C. Viral gastroenteritis. D. Pneumococcal pneumonia. The correct answer is D. Pneumococcal pneumonia. Infections caused by encapsulated organisms are common in asplenic patients. Patients with sickle cell disease become asplenic secondary to multiple infarctions and are at increased risk of infection. Pneumococcal and meningococcal vaccines are very important in such patients. Penicillin prophylaxis should start at 2 months. Some recommend continuing to age 5 years, others until adolescence. You have just completed NCLEX Reviewer number 9, which featured questions on reduction of risk potential. Check out our NCLEX playlists for other NCLEX Reviewer topics. If you haven't done so yet, please don't forget to subscribe to Review Central and click or press the bell button to make sure you get notified whenever we post a new reviewer or other review materials on this channel. Please like if you find this video useful and feel free to share to anyone who may also benefit from it. We wish you all the best on your forthcoming NCLEX.